something I didn't think I would have to say, but please do not take contraception medical advice from Elon Musk. He has tweeted to his 172.9 million followers, "Hormonal birth control makes you fat, doubles risk of depression and triples risk of suicide." This is a clear scientific consensus, but very few people know about this, and it's had 35 million views. And I'm not somebody who reacts a lot to what I see on socials, but this one I had to just correct. And the responses under his tweet are all saying, come off the pill, women should stop taking hormonal contraceptives. I'm Dr. Nigat Arif, an NHS GP who's a specialist in women's health, author of The Knowledge, Your Guide to Female Health from Menstruation to the Menopause, as well as a health content creator for WHO FIDES and YouTube Health. Now, this tweet from Elon Musk is clinically inaccurate and misinterpretation of the data. So let's talk about that. Hormonal birth control has the same risk of increasing weight as non-hormonal copper coil, but there's so much that we can unpack here. So let's discuss what are hormonal contraceptives. These are all the hormonal contraceptives. I've laid them out as combined with estrogen and progesterone, and those that are progesterone only. So you might be looking at this and thinking, actually, I'm on some of those, and that's absolutely fine. Each of those medications would have been discussed with you with risks versus benefits, and then also the length of time that you'd want to stay on them for. The Cochrane Research Collaboration did a meta-analysis in 2014 and 2019, and after doing randomized controlled trials, found that none of the trials came to the conclusion that hormonal contraceptives caused weight gain. However, this does not rule out individual experiences of weight gain. On the Lowdown app, where women are sharing experiences, some people may experience temporary weight gain when they first start taking the pill, but this is often fluid retention rather than fat. Theoretically, synthetic progesterone and also estrogen can cause fluid retention and also weight gain. So it's important to keep a close eye on weight. So we have so many studies now as this and a couple of others that show, yes, weight gain does happen with progesterones, but it's temporary. You need to also think about that sometimes diets or level of physical activity might have changed. And if you're concerned, then don't panic about coming off your contraceptive straight away. It's always worth having a discussion with your medical provider, and a contraceptive type change might be recommended. So let's look at the other aspect. Does hormonal contraceptions impact mental health? Well, the risk of suicide is no greater on hormonal contraceptives. As with any medication, a percentage of patients do have adverse responses, and I agree, have a psychological impact because of taking hormonal contraceptive. And this is especially obvious among patients with reproductive hormone sensitivities, such as progesterone sensitivities or also estrogen sensitivities. It's universally recognized that some hormonal contraceptives can impact on your mood, causing anxiety, low mood, loss of libido. Hormonal contraceptions have a whole range of side effects. If you look at these, you're probably looking at them and thinking, I have these. And I do treat a lot of my patients who come in with these, and we know that this happens with synthetic estrogens and progesterones. A study published in Harvard in 2019 looked at this very precise thing. Can hormonal birth control trigger depression? And it came to the conclusion that all forms of hormonal contraceptions are associated with an increased risk of developing depression. The thing that also this study was able to show us in 2009, that IUSs, so intrauterine devices like Mirena, Kylena, Levocet, we always thought had a localized response, but we do realize that they don't have a localized response. They're also taken up in the body. And so actually the researchers said really clearly, does that mean we should stop prescribing hormonal birth control? No, because it's important to note that while the risk of depression among women using hormonal forms of birth control are clearly slightly increased or are increased, actually the overall benefit of having an unwanted pregnancy is better. Please do not stop taking your hormonal contraceptives, as the risk of an unwanted pregnancy increases if you're having unprotected sex. Therefore, actually, one could argue that that's affecting your weight and your mental health more, especially if it's an unwanted pregnancy. Other than these just being contraceptives, these hormonal contraceptive medications provide management of symptoms such as heavy periods associated with uterine fibroids, PCOS, endometriosis, adenomyosis, which can cause painful periods, affecting a woman's ability to function, ability to leave the house, to work, to provide for her children and her family, and carry on with her life. For many of my patients, I can say that hormonal contraceptive medications are literally life-saving. I see this in my clinic consistently. Hormonal contraceptives, I believe, is the single biggest tool for women's liberation that we've had in the last 100 years. We should be wary of people who don't have our best interests in mind, who criticize the thing that has allowed us to become economically and politically independent from men, whilst also making sure that we are objectively and thoughtfully having conversations about the flaws. And I know all of these medications do have flaws and side effects. Again, I see that and counsel that to my patients. Maybe a better approach would be to proactively be at a stage where we are prescribing a male contraceptive pill and not overturning Roe versus Wade, taking away women's reproductive rights. It's time that we actually made men an active part of family planning and also having a think about what they could do for contraceptives, whereas we are still at a stage where women are suffering with side effects of contraceptives, and for some reason, well, I do know some of the reasons, we are still at a stage where we haven't developed an effective male contraceptive method. Condoms, femidoms, diaphragms, we do have other barrier methods. So hormonal contraceptives are great for preventing a pregnancy, but for STDs, there are barrier methods that still be used. But actually, we know from time and time again in data that condom purchases are high, but compliance is still low. So yeah, I think that if you're going to do something, please don't take medical advice from Elon Musk. I will come off my high horse now.